Okay, we're going to begin with the second panel, which is on mental health co-response in policing. But before we do that, I just want to remind everybody, this is our last part of the symposium here in Lipkin Theater. We will be moving over for lunch to College Center 220, and the two panels in the afternoon will be over in that building. Also, the Peace and Justice Conference continues tomorrow with our map unveiling at 10 o'clock on our Injustice map. And then that's followed up by the Nakamuras, who I referenced in my earlier comments, who run an NGO that deals with former child soldiers in the Democratic Republic of the Congo. So that's that'll be very interesting. I also understand that Mr. Nakamura is a guitar player, so maybe we'll have a musical accompaniment as well. Anyway, I hope after our last panel and through our panels during the day that you're feeling a little better about things. You get to see what's going on right here in the Lehigh Valley with some people who I think are amazing superstars. You saw 3 of them in person, 1 virtually, and you're going to see 4 in another minute, and then this afternoon you'll see 8 more. But these are people who are really making a definitive change for the better in our community and are going above and beyond a normal job description in what they do. So I'm very happy to welcome our second panel. And if you could all take a couple of minutes and introduce yourself and talk a little bit about your work. We can just go right down the line.
Do I have to, you can hear him?
Yeah,
I'm really
good.
bad with microphones, so usually I just project my voice out if I have to. So my name is Vicky Conte. I am the Director of Community-Based Mental Health Programs for Pinebrook Family Answers in Allentown. We have been working, we created this program called the Police Department Mental Health Liaison Program in 2017. That program is just like the rest of our agency. We like to call ourselves trauma-informed. One of the things that I do, in addition to overseeing this program, is I also go out into the community and train individuals basically in Trauma 101. How can we be more aware and understanding of individuals who have experienced trauma? And I do throw that out there to everyone because I feel like most people have experienced some sort of traumatic event in their lives. And I'll even reference the first time we closed lockdown for COVID as being one of those experiences. So I like to help people identify that many individuals have experienced traumatic events. Our program began in April 2017, and that was through a PCCD grant, and it was administered through Lehigh County Mental Health. They came up with this idea that they wanted to get more involved with the community and help individuals who had severe mental health issues from being incarcerated. So we work very closely with the Allentown Police Department, as well as all of the other police departments in Lehigh County. We also are working with the magisterial, some of the magisterial judges. They can refer to us as well. And now we've just opened it up kind of to the state police that they're able to, utilize our program and contact our community intervention specialists. So we'd like to come out with the understanding that we use something called the sequential intercept model, which is where we can try and intercept individuals early on in the process, before they get to the point where they may be incarcerated or hospitalized. We really try to mitigate that from happening. Sorry, I'm a little nervous speaking in front of everyone. The program began with just one individual, one social worker embedded within the Allentown Police Department in 2017. It took some time for that to actually really take hold because there was a feeling of having to gain each other's trust in working together. So the police chiefs all along from the beginning, the beginning of the program through current times, all the police chiefs seem to be very receptive of this program. we can alleviate them from having to deal with some of the things that they're not equipped to deal with. We like to think that our relationship with the police departments is built on mutual trust and ongoing communication. And then, so as the program showed signs of success in its early years, Lehigh County Mental Health expanded the program and added another individual to service the whole of Lehigh County. And then in 2020, the Allentown Police Department gave us a contract and said, we'd like to get a second social worker in the Allentown Police Department. So, you know, we've been showing growth all along. And so currently, and also we've received another contract with Lehigh County. In 2023, we were able to add 3 more individuals to serve the whole of Lehigh County. So in total, we have 5 community intervention specialists out there. Just a little bit, I like to tell people where our funding comes from, because that's what drives these programs, is being able to secure funding for these positions. I think that is a good amount of things for me to say. I will pass it to Ellie, who's one of our community intervention specialists. She works in the Allentown Police Department very closely with the police, very closely with the community members, and very closely with all of the providers that are available to our community members.
Hi, my name is Ellie Flores. I am, like she said, the community intervention specialist in the Allentown Police Department, embedded. I began in Lehigh County and then was transferred over to the Allentown Police Department. I want to say that one of our, where I feel like I'm very proud that we have a community intervention specialist, that he is a CRS and vet specialist that all the departments can utilize when dealing with individuals who are suffering with addiction and or, you know, veterans. Oh, community intervention specialist. Oh, certified recovery specialist. I'm so sorry. And so we utilize him often, and it also helps with older individuals who don't want women coming to talk to them. So how I get referrals, I do a little bit of everything. I do ride-alongs, I get referrals via email, phone calls. I can get called out to a scene. We try to respond as quickly as possible. We develop relationships with our individuals. And one of the things that I say to all the CIS is, if you do not have relationship building skills, it will be very difficult when you are dealing with individuals who are severely mentally ill. I am out there, I am boots on the ground, as they like to say, engaging, getting to know individuals. They may not want the help in the beginning, but I do everything possible so that they know I'm around. I'm going to offer the help. I am going to continue to check up on them. I've had individuals say to me, Ellie, I think it's great you check on me. I'm just not ready. But I continue to go out there. I continue to do the work. I also let individuals know when they're not happy. So in Allentown, when they're not happy with the police, they don't care for the police. I let them know the police are the ones referring to them because they matter and they see a need. And so that actually kind of breaks the ice a little bit. And I'm able to chat with them and then see how I can connect them with services. We are really lucky to collaborate with the numerous resources out there, including crisis. So we work together to respond to individuals. And so I work really, really, really hard to help those who really want the help and try to connect them with those services. Benay.
Thank you, Ellie. Hi, my name is Susan Benay Berger. Everyone calls me Benay. I am the Director of Nursing and the Community Connections Program at the Bethlehem Health Bureau. So what's, I think, most interesting here today is the Community Connections Program. A little about my background. So, well, my undergraduate degree is in political science with a minor in education. And then I went back and got a degree in nursing. And I'm now in the process of finishing up a master's of social work. So I've gone backwards in terms of what I'll get paid, but that's okay. And one of the reasons I'm getting that master's in social work is because the incredible need for mental health professionals everywhere and anywhere. So in the Bethlehem Health Bureau, when we collaborate with the Bethlehem Police Department, and I would love to say this was my idea, but it wasn't, back in 2021, Kristen Wenrick, the director of the Bethlehem Health Bureau, and Chief Michelle Kott, the chief of Bethlehem Police, collaborated together to start a program where a social worker would go out with police in the field when there was a mental health crisis or acute social need. As Vicky and Ellie alluded to, there needed to be some relationship building. And I think that the officers at first were a little curious, what do we have to do with this social worker? We have to take care of her. What are we going to do? But they have really wholeheartedly embraced this program. I think that's because the culture of the Bethlehem Police starts from the top, and Chief Kott is not just supportive of this program, but a champion of this program. So we are now 6 strong. I manage the program. We have a data analyst, and a community engagement professional who happens to be with us here today. She is also a co-responder and goes out with police. We have 2 master's level social workers, 1 licensed, 1 in the process of getting her license, and undergraduate social workers. So we have a very strong team of social workers who have a great deal of experience with mental health and dealing with people in acute crisis. My nursing background as an emergency department and urgent care nurse that dealt a lot with psych has been a huge help to me in my going out in the field. I do both management, but I also like to stay boots on the ground as well, as often as I can, to keep in touch with the officers and the community that we serve. So we are thrilled to have this program going strong. We started out with grant funding, and we will continue to look for grant funding, and we have also city support as well. Our mayor and his administration are very strong proponents of this program, and so it's really nice to have that support. And I will let Chief Kott talk about the police side.
Good morning, everyone. I'm Chief Michelle Kott with the City of Bethlehem Police Department. I've been employed by the City of Bethlehem Police Department since 2004. So I've been a police officer for 20 and a half years. I'm approaching my 21st anniversary this July. Throughout my time at the police department, I've done a little bit of everything. I've been a patrol officer. I helped out in our vice unit doing narcotic work. I was a long-standing member of our forensic services unit, where my heart and soul resides, back in the criminal investigations division. I was the first female detective lieutenant at the City of Bethlehem Police Department. I became then the first female captain at the City of Bethlehem Police Department, where I worked in our professional standards division, doing accreditation, internal affairs, policy, procedure, training, and brainstorming, coming up with innovative programs that would benefit our community. And there were a lot of bad things that happened in 2020, if you remember, one of which being the murder of George Floyd. And I am so grateful to Kristen Wenrick, our Health Bureau Director, for extending her hand and reaching out to the police department to come up with a program that our community not only wanted, but demanded. They wanted to see change. They wanted to see the police being receptive to the community's needs. So we put our heads together and worked on a program that wasn't going to be window dressing. That wasn't going to be just another police program where, a joke I like to say is every police department says that they're community, policing, but they're really not. It's just window dressing. We wanted to actually put something in practice that our community could be proud of and knew that they were being heard. Because in my perspective, policing in a democracy is being responsive to your community. You're doing what your community wants. You're not trying to control your community. You're working with and you're serving your community, if that makes sense. So we came up with this program, the crawl, walk, run mentality. We wanted to make sure that we did the program right. So we started off small, using a very small sampling of the police department to introduce the program to start off with referrals only. And the program just took off. Once the officers and the social workers and mental health workers were working together, officers that weren't involved in the pilot program were upset and wanted access to the social workers as well. So after we were able to successfully implement the pilot program, we expanded department-wide, at which point other city departments got upset. Our paramedics, our firefighters, our housing inspectors were like, wait a minute, why do the police just get access to this awesome program? Why can't we refer things to the social workers as well? So now, God bless these amazing, amazing people, because they are getting referrals and contacts, not only from other city departments, but from community members as well, who may not be as willing to pick up the phone and call the police for help, but would rather just go to the source and get that help that they so desperately need in meeting those unmet social service needs. That's a little bit of a background about our program, just a little bit more background about me. So again, 20 and a half years at the police department. I'll be chief at the City of Bethlehem Police Department for 5 years this October. I have a bachelor's degree in criminal justice from DeSales University, a master's in criminal justice from St. Joseph's University, and a doctorate in criminal justice from California University of Pennsylvania. Now I believe it's called Penn West. Additionally, I always like to throw this out here. I am also an adjunct professor with Northampton Community College. So happy to be here.
If we can stay with Chief Kott just for a moment. I used to say when we were first putting the Institute together and learning about the state of things in the Valley, that Chief Kott was probably one of the 10 most progressive police chiefs in the country. Well, my view of her got vindicated by Harvard University when they picked her as one of 10 police chiefs nationwide that they sent to Denver to study their co-responder model. And I thought maybe you'd like to talk a little bit about your experience in Denver.
Absolutely. The trip out to Denver was mind-blowing, eye-opening. The programs and the procedures that Denver is implementing is something that I would really, really love to see come to the East Coast. Part of the program was not only to study their co-responder program, but also the drop-in centers that are available, that a police officer, instead of trying to arrest their way out of everything, arrest their way out of a mental health crisis, can take that individual to a drop-off center where that individual will have access to social service care and mental health care, rather than being put into a jail cell or taken to the county jail. So, or dropped off at one of the hospitals that are at max capacity right now, for not only, medical emergencies, but also mental health reasons. So that was extremely eye-opening, was just how well all the different components of not only the criminal justice system, but the healthcare system and mental health system work together out in Denver, Colorado, and all the various options that are available to community members when it comes to getting their needs met.
Good. And for our healthcare providers, can you give us a description of the kind of services that you offer?
So when I respond to a call, depending on what I'm being called out to do, I sit with the individual to figure out what is the need. And from there, we will then either I assist by taking them because they don't have transportation, sit with them through the process. I have gone to ERs and sat with them while they are going through a 201 process, which is going inpatient. So I support and also refer out into the community until all services are in place for them.
And I can speak for the Community Connections, the Bethlehem Health Bureau, Bethlehem Police Collaborative. So we're structured in such a way that we respond in several ways. I think Chief mentioned that when the officers come in contact with someone in the field having an acute mental health crisis, or they see a family that really has social needs that they can tell are not addressed, which, by the way, I have to say, prior to this program, the Community Connections program, I had not directly worked with police in a collaborative way. As an emergency department nurse in inner city Baltimore, we dealt a lot with police and they were always great, but I had not really worked with them so closely. And then, you know, I think the police have had situations that have been notorious, and we had the murder of George Floyd. And I think that, I didn't know that I necessarily had an opinion about police or not about police, but in this program, I worked literally daily with multiple Bethlehem Police Department officers. And I have to say that in Bethlehem, the officers really care. At least almost half of the Bethlehem police force has gone through a week of, they get their basic crisis intervention training, and they've gone through a week of an intensive week crisis intervention training with a focus on mental health, and they're very, very good at this. They don't really, most of them don't really need us to come assist in that capacity, but we can do that. We do that, and we can help take that to the next level so they can go on and continue to do police work, and we can take over that situation that Ellie just described, where we might accompany someone to get the mental health services that they need or refer them, whatever that will be. But we've been working very closely with them, and they are really receptive of the program, and they do see the benefit of having mental health and social workers in the field to continue with services that the community needs. So it works this way. The officers have a situation where they notice there's a need. If it's not immediate, they can refer to us through an electronic system that we have at the Health Bureau, and that the police use and the Health Bureau use. So we get these referrals, we get a description of the need, social workers respond to that immediately. If it is a really acute, please, I need your help in the field kind of need, they will call us, we will co-respond, we will go meet the officers and the individuals where they are and start to get those services, that assessment done, and those services started right there when it's needed. And we, on a daily basis, we have the health bureaus on the second floor of City Hall in Bethlehem, and that's where we primarily operate. But we have an office down in the police department so that we have a social worker there Monday through Friday available to speak with officers, give advice to officers, talk about cases with officers, to meet with people who come in off the street to the police with whatever situations they may need assistance with, or then to do that immediate co-response with police in the field. And usually every day at some point, we have what we call a mental health unit out in the field. So that is an officer and a social worker, a trained social worker. So we are there available to be right on site should we be needed. So those are the ways that we function in our program. But as Chief alluded, we are getting referrals from the fire department when they encounter someone with a social need. We get a lot of referrals from our code enforcement when our code enforcement officers go into the field and they are determining the safety and well-being of a structure. If the structure needs to be condemned, they will call us. So if they're tenants in that building, we can start working on temporary housing solutions. And we have our EMS when they deal with people who are elders in the community who clearly are not in a situation where they're able to function well at home, but they are home and they are alone. They will refer to us, and we can go out and we can meet those individuals where they are to see if we can't get some services either in place or get them into a better situation. So a lot of our city departments have caught on to the fact that we can help a lot of people, and we get a lot of calls, which is great. Just need a few more people. But so it's been really successful in that capacity. And the other thing that is happening as we help connect people to services and help families in our community, word spreads. So community members themselves do self-refer to us, which is great. Again, we are, unless we can get another 10 social workers, we don't publicize that we will help, but we certainly do. So that's kind of the basis of how we work, and it's been very successful. And something that Dr. Bailey on this last panel alluded to is when we're in the field, we do want to make we make those assessments, and we refer people and get them to the mental health or social services that they need. We are lacking in mental health services in our community. Sometimes we're standing there thinking, I know I need to refer this person, but where? So what another function of the Community Connections program is that we work very closely with all the community-based providers in our area. So we get a good understanding of who they are, what they do, and how they do it, and how we can most quickly and most effectively access their resources for our clients. And in that, we have a lot of meetings and a lot of conversation. And together, this includes our hospital systems, LVJI and St. Luke's, Magellan, the mental health, the community-based mental health providers. We meet with them on a regular basis to discuss the gaps in care that we're all seeing. Chief also alluded to, taking an individual to the ER when they need either a voluntary or an involuntary mental health commitment. Sometimes they don't really need that inpatient, but there's nowhere else for them to go. And we don't want to use, I was an ER nurse, and we got all the patients in there who didn't really need to be there, but we understood that there weren't any other services to which we could refer them. So I think another very important part of our program and the Pinebrook program in Allentown and the Allentown Police Department is that connection with community-based services, the hospital systems, to get together to discuss the gaps in services we all recognize and we all see, so we can do something about it. And we do that. We meet with Ellie. I know Ellie we train with Ellie and the Allentown Police Department and the Bethlehem Police Department on a regular basis for crisis intervention and suicidality and those kinds of situations. The Allentown officers are also fabulous. So we have a really good sort of big resource. Also, a lot of our clients, they don't know borders between Allentown and Bethlehem. So we serve many of the same clients, within a week period. So that's another component of our programs. And then third, I think that is very important that has come to light is that once with all of our community partners in the hospital systems in Magellan and Pinebrook and all of our community-based mental health organizations, once we identify these gaps, we want to come up with solutions. And that's where we want to address things on a policy level. Are there policy changes in the cities that we could start to initiate that might address some of these gaps? Or is there advocacy we need to do with any of our representatives about getting more of those badly needed mental health dollars into our communities? So there's a tiered system with these programs, and they address this need on a multiple of levels.
Thank you. I think one of the themes that you will see repeated through all of our panels, and you certainly saw it on our first panel, is just the dearth of mental health professionals. And so if there are any students here that are wondering what career would be the most efficacious to making the world a better place, please consider mental health. I think everybody would agree to that. For all the panelists, could you give us like one anonymous success story that you're particularly proud of?
I am super proud of this one. So, this is an individual that I met when I first got transferred to Allentown. And when I tell you, I was probably going to her home 3 or 4 times a week. She had 6 barricaded situations with the the police department. They were like, Ellie, you have to do something. I met her, I honestly, the month of June, I will never forget. I counted the text messages this woman sent me. It was 183 text messages. The need, the desperation, severely mentally ill, trusting no one. Wanted to die suicide by Kott. Like, I had to collaborate with the police department. It was insane. A year and a half later, We are good. She is doing well. Not to say that we haven't had our hiccups, but her last barricaded situation, I was on my way home and I got a call from a police officer and they were like, you need to come to so-and-so's home. I'm like, okay. I turn around, I go there, and it was the entire neighborhood was shut down. And you will appreciate this. I violated every rule. They were like, stay behind the police officer, do this, do that. But because I had already that relationship with this individual, to me, it was like, yeah, no, I got this. And then I was like, oh God, I'm in trouble. Anyhow, I got her to open the door. I got her to drop the knife. I took her to the hospital. Our officers were great. They were like, she didn't want to be handcuffed. She didn't want to be taken out the front door because she was embarrassed. So they brought a car to the back. I went to the hospital with her. I think I stayed till like 10, 11 o'clock at night until she was situated. She was afraid of having a team. We collaborated. We did all these meetings. She now has a team. I still meet with her once a month because if I don't, she kind of gets a little like, what's going on? Like, because she does not trust. But it is one of those situations when I tell you I was there 3-4 times a week. Vicky's like, what is going on there? Like, we need to pull back. But it's such an amazing story. I was with her this morning and I said to her, I can't wait till you're comfortable enough to come speak with me on how everything changed for you. And, she is trying to build her trust with the police departments. She does not trust men. There's this a whole lot, but she is working on all of this. And so I am so proud of her because the minute something goes wrong, she's no longer creating chaos, let's just say that, and then having these situations erupt. And I have another one. God bless Chief Roca. He gave him his cell phone number. He was calling all the time. And I would see reports for him continuously. I'm like, oh my God, who is this person? I met with him, met with the team. We started working together. I got him to recognize that 911 was not, I stubbed my toe or I'm upset with the police or why are they sitting over there? Those type of things. We got more services in place for him. And he barely calls us. He'll call me to give me an update or text me and say, hey, I just want you to know, blah, 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 blah. I hope you're well. So those are two that I'm really like, it's worked and we're so grateful.
So I did bring this with me because I knew that question may come up. And I just wanted to read an actual note that someone sent, which was, it was actually to Ellie, saying that this individual is very grateful for what she's done for her and her son. And she says, I do not feel like I am alone struggling anymore. I feel a little stronger knowing that I have someone to talk to and that can help me. Thank you for all your support. And that's just sort of a small example because I can show you pages of individuals that have then reached back out and said, thank you so much for your help. Thank you so much for assisting us. The piece I wanted to sort of say about that is that that's not what this program was really created for. We were created to help individuals and connect them with services, and then we close the case and we're done. But we found that by providing that support and saying we're here, you can call us anytime, has kept people sort of on task to stay out of involvement with the police. And so they're not engaging. If they have an issue, they text. They have Ellie's work cell phone number and they can text her or they can call her if an issue comes up out of nowhere, and they can have that support if they need it. Again, that wasn't the idea behind the program, but now with thousands of referrals within the county of Lehigh, it's hard to keep up with. We do need 10 more people, right? Like at the least, right? If we could have more social workers. And again, it's putting emphasis on the idea that there is not enough service providers for all the individuals that need help. We have a huge homeless population, and although we'd like to connect them all with all the services that they need, maybe they don't qualify because they have other issues around why they're homeless, or there is no place to place them. These protective factors, and I will always talk about that, If we could supply protective factors for our individuals that we engage with, if we could provide them with the secure housing and secure employment and secure food distribution and all those things that provide security for individuals, we would probably have a lot less referrals coming through. People would be a lot less in distress. So I just always kind of like to throw that in there because I think it's important for people to hear that.
It's a great question about success. We have a lot, so many anecdotes, and it wasn't me. Well, this one, the anecdote I'll tell you was mine, but we have such a great staff and so many success stories. I wish I could tell you the many success stories each of our staff has had. But one of the ways we are trying to measure, so we need dollars, right? So we know this program works. The community knows it works. Our director knows it works. Our chief knows it works. The mayor knows it works, but we need to prove that. So we hired a brilliant data analyst in community engagement who also happens to be sitting right here, who I'm outing right now, being called out, but who has developed a system of collecting that data. Like, how can we, with data, prove that this program is effective, is working, and is helpful? And so we have seen the number of clients we serve. So since 2023 through 2020, since the inception of the program to now, we have helped 1,300 people. In 2024, I can't even remember my own chicken scratch here. I can say that the recidivism, so how we measure that is people who have contact with police over and over and over, and they are our clients, and some of them will continue to have contact with police, but we've had a tremendous reduction in the number of individuals who have had that recidivism, that again, the same issues, because we have connected them to services. If you want really good data, I'll leave you my card because I can't really spout it out, but we have it because we now have this data analyst who can help us get that. She's also found out when the police seem to need our services most. Turns out it's in the afternoon and the evening. So we're shifting our shifts so we can have coverage for them at that time. We don't have nighttime coverage, unfortunately, because you just don't have the staff or the dollars for that staff. But we do, like every police officer, when we can, to have experience with what it is that we do and how we can assist, so they know to refer to us or even call us out when they need us. I have one success story that I think speaks to the efficacy of this program in general. So at the Bethlehem Health Bureau, we have many programs, one of which is the tuberculosis. We will treat anyone with tuberculosis in the city of Bethlehem. We had a client who had tuberculosis. In our efforts and our home visits with her, we identified her son, who fortunately did not have active tuberculosis, but who needed a variety of services. We treated the mom. We started dealing with the son. There was a lot of conflict between the mother and the son. They had multiple police episodes. There was substance abuse involved, and they were actually both very bright, very nice people who had a lot of talk about trauma, a lot of trauma in their lives that led them to have these substance abuse issues and the behaviors that they did, the mental health issues that they did, really a lot of trauma in their backgrounds. We dealt with mom. Unfortunately, she died of cancer, which was very tragic, but she successfully was in our program. But the son, really, he was such a bright guy, and he had such a rough start. And he had an interaction with the police, and it wasn't positive, but he was trying to protect his mother. So the police and the community connections, we worked together to make sure that this guy, it wasn't a violent interaction, but there was some shoving. You can't shove a police officer, nor should you. So he had to be accountable for that behavior, which we fully appreciate. He took responsibility for that, but the police and I, as the social worker, I went to court with him for the hearing. And so we want to try to divert people who don't really need or won't benefit from being incarcerated into services where they will be better served. So for example, with his mother, also interaction with the police, and with her son, she was incarcerated, but I was able to get her out of that incarceration situation. What she needed was mental health treatment and substance abuse treatment. She was taken from the prison and went into the recovery program that was a dual diagnosis for mental health and substance abuse, and she did very, very well. The son, we went to court, he had his hearing, and the judge, after hearing his story and speaking with him, gave him a sentence he had to be responsible for, but it was the least severe sentence he could get. And as long as he towed the line and got a job, he didn't have to do any prison time. And there's some hiccups along the way, but I have to say, I spoke with him the other day, and he is, not only has he kept his job, but he's stopped using substances, and he's going to be taking classes here. So it's just a really great, it's great to be able to change the trajectory of someone's life by recognizing that trauma, by having the police recognize that trauma, by having, police departments employ people who can help take them from that justice system and incarceration into a program that will better suit them. I'm not saying, and listen, there's some people who think that social workers should go out in the field by themselves if somebody identifies a situation as a mental health. That will never happen in our program, because you don't know what is something. Someone might think that there's a mental health situation that's not dangerous, and it could be dangerous. So we always go with police, and we respect that police control that situation, and then we step in when we're needed. But it helps keep us safe. It helps keep citizens safe, and it's something that we do collaboratively. So I think it's really important to understand the police part of these programs, because we are equal in our impact on the community. Another thing I think these programs can help do is, at least with police departments that deserve it, which I think the Bethlehem Health Bureau does, and I'm sure Allentown does as well, is change the narrative of how police serve the community. Bethlehem residents are beginning to see that police are not just the law enforcement arm. They're just not punitive. They're not out to say, you did this, you did this. They are there to serve. They identify you have a need. They're going to try to address that need. And if they need a little extra on the back end, they're going to call us in. And I think it's really important that people understand that is also the role of police. And that is certainly how the Bethlehem police, with whom I've now worked for 3 years, function. And so I think that it's a really important part to understand. Both components are a very important part of this equation.
If I can jump in a second on data analytics, we actually have designed a study that would combine the work in Bethlehem with the ongoing and hopefully expanding work in Allentown as they roll out a more robust program. And we're currently seeking funding for that. We were hoping to get that from the National Institute of Justice. Unfortunately, we now have to look solely to private funders because you hear a lot of people who do not understand the needs of our communities running around and saying, waste, fraud, and abuse, waste, fraud, and abuse. The real waste, fraud, and abuse is not studying these programs that we know work, and so we can find which aspects of them work the best and where we can concentrate our resources. And to not do that work, to not do that kind of academic research is the real waste, fraud, and abuse. End of editorial comment. Chief Kott.
So my biggest win was Ms. Wenrick telling me they're disrupting our meetings. When I found out that the Health Bureau was trying to hold meetings up in their section of City Hall and our officers were going up, interrupting these meetings. Hey, I need to talk to Benay. Hey, I need to talk to so-and-so. We have an issue downstairs, or I'm going out to this house and we need a social worker. Finding out that, it's all fine and dandy to have a program, but to actually have your people buy in and seek out that support and help is a huge win for me.
Very good. I'd like to open it up to questions from the audience. Have Bob? Oh, you need the mic.
Thank you. Not so much a question, but an observation. As a former county commissioner for Lehigh County, I was very much in support of and to fund the CIS personnel for Lehigh County, and had an opportunity to do a ride-along with former Sergeant Ben Yobst, who is a superstar in my viewpoint. And I saw how much the work and the effort that they do to de-escalate, how important it is and how well it works. So my other comment has to do as being a former commissioner and one who would vote on funding for various programs. I would like to see the metrics that you say you've put together, and it would be great to package that and use it for efforts to convince the powers to be who have the funding influence to be able to support these programs. So getting that data out, again, data-driven change, the more data we have, the better we can make decisions to fund some of these activities that are so vital.
I
Thank
like
you.
that slogan, data-driven change. I saw that somewhere. Does anybody want to respond to Commissioner Elbick's observation?
You're spot on. You're spot on. People want to see the numbers. They want to see that, it's working. And that's why, it's so incredibly important to keep track of all of that. Because it's hard to argue with when we're able to show, especially with our, recidivism rate, the program works and it deserves to be funded. It deserves to be touted, just as much as any of the other programs that are out there that are being funded.
I would actually just add a little piece to that, though, just recognizing that we have a very small staff for a very great need. And we are acutely aware of how much time it takes for those individuals, for those community intervention specialists in Lehigh County to be going out and working with individuals, and for them to sit down and have to put that data that they're collecting into a system is also pretty onerous. So data collection on our end we've been through many different waves of how we do that. And we are continuing to try to improve that so that we can prove all the things that everyone thinks it's also about what do the funders want to see? And so that is what we're always trying to narrow in on. What are the numbers that they actually want to see as opposed to what we collect? So just to let you know, there is an ongoing effort to try and refine this and hone this and, be able to bring the best information out to everyone that we possibly can.
One of, as human service providers, and I put all of us in that category, right? We're a very, very large voting bloc, very powerful voting bloc. But because we've existed in this world of siloed resource, right, management, we do a very poor job of collective advocacy. But the reality is that every single one of our service providing entities would benefit exponentially by having more resources, both in people and money to do this work, right? Less crime, right? Better education, right? Better health, right down the line. And so I say that to say there needs to be a better system for bringing us all to the table to do this work, right? To get the powers that be at the table to say collectively, right? It's not just teachers marching on Harrisburg, right? It's police officers, teachers, healthcare providers, right? All standing at Harrisburg together, right? The message that sends is, oh, there's some collective power to that, right? Like we got a problem, right? This could change Congress, right? By looking at those kinds of numbers. But as long as we allow ourselves to continue to be siloed, nothing changes because they can just divide us, right? So That you want to talk about real community change. That's where it lies. That right there, right, is 10,000 of us standing in Harrisburg together. That cannot be ignored. So just food for thought.
Wish I had a giant exclamation point.
I just want to, want to make a comment from that. I have now told my family, so when I have a family member, a mother, a dad, a sister screaming at me, not at me, but just venting that, I call crisis and this is baseline and they can't do anything right now. And the police are saying, kick them out and get a PFA. And they're screaming, how is that helping? That's not helping. I need help. I want help. How can he make a decision for himself, right? To get services, to get treatment, to go inpatient. And they're saying it's his decision because he's an adult. So I have now told every person that I come in contact that is yelling at, call your local representative and let them know that this is the struggle and this is what you're going through and there needs to be change. So last week, 3 people called. And that's just exactly what I say to every single person that I am working with as they are struggling because the adult has the right to make that decision. But yet we know they're severely mentally ill, but not enough to meet criteria because you know what? That's their baseline.
And I might just add to that point, call the local news media. This is a point, I was at an event with Susan Wild last night, and this was a point that she made. The local news media, as well as our local representatives, both on the state and federal level, need to hear individual stories from affected people. And as Susan Wild said in that meeting, it affected me as a representative in Congress if we were getting multiple calls about a particular problem, and then we would take an in-depth look at it. And that is one of the most powerful things that we can all do in this next period of time as we try to navigate things.
May I just say, with Dr. Bailey's comment, yes. And that is what I think the Community Connections program has recognized as we deal with our community-based providers and partners. And we all face the same challenges and we all see the same lack of services. That is a big effort. We're trying to get a collective voice. The Bethlehem Health Bureau in general does a lot, and the Bethlehem Police Department with the Bethlehem Area School District. And the more voices, the more power we can have together and make our statement in Harrisburg and make our statement to the local they're not going to be able to not hear it, because if it's coming from the schools and the police department and the health bureaus and the hospital systems and the mental health providers, that's a lot of voices to ignore. So I think there's huge benefit to harnessing that collective power and trying to make substantive changes locally, community-wise, and state-wise, and hopefully as a model for the rest of the country. But that's a very, very important point. We need to not just see these things and try to fix them in siloed efforts, but to work together.
We can probably fit in one more question.
I think this is more directed to the data scientists, but it is also relates to the political problem that we're facing. We want to expand the support to this to the more conservative Americans. And we do that by extrapolating all these experiences into what is the cost to the taxpayer. What are we saving the taxpayer by diverting people from incarceration into therapy or other services? And I think that's what the Institute is trying to do. But if we can, can you be more helpful in that respect? I know it's hard to estimate, but if you had in your notes that this person would otherwise be arraigned and may spend time in incarceration at a, and then we take the ball from there and say, this is what that would cost.
Leave it to the businessman. Yeah, this is the maximum. Pay now or pay later. And if you pay later, it's going to be a lot more money. Aside from just all the collateral effects of the human damage being done. But sure, that's our question for the panel.
We love to help. Again, keep pointing at this over there. Our data analyst is very, very good at it. And she has an answer, so why, she's gonna give it.
The microphone.
So I do have numbers on the re-referrals that Benay had mentioned. So we have about only 14% of all of our referrals for Bethlehem that were re-referred, right? So we've seen like, what, 1,300. So only about 183 people got re-referred again, right? So if we're able to get the operational costs from the police department and the judicial system, we would be able to monetize that number and be able to share it.
We're certainly happy to help in that effort. Sorry to say, we have to wrap this up or people will just run out to lunch. This is as I said, this is the last event we're having here in Lipkin Theater. The rest of the day's event will be over in the College Center building, which is just directly across the walkway. And lunch is being served in College Center room 220 on the second floor. We'll, over lunch, we will be having a presentation by Yusuf Dahl on the Thurmond Amendment. Thank you all so much, and thank you to our panelists.